there are good people out there and there's bad people out there, you know, but because there's so many stigmas attached to people with HIV and AIDS and, you know, the drug use component, the prostitution and different behaviors that people engage in, you know, maybe at some point of their lives, maybe not. We don't know. But there's a lot of discrimination and people assume and they judge. And that makes our jobs 10 times more difficult.
Exactly.
Because we have to deal with all of that as workers. We have to deal with it. So if we have to deal with it, imagine what that client faces. Imagine how they feel.
I was arrested a number of times. And I use a number of times very lightly, a lot of times, because drugs took me to people, places, and things. And the more I could get, the more I wanted, and the more money I had to buy it. I'd had enough, you know. I don't know, a light bulb just goes off, and I just had enough, and that was it. And I needed to get away from the environment that I was in, which was at the time in Manhattan. So I just got on the train, and I just kept telling myself, just get off at the last stop. And the last stop was at the ferry terminal. I got on the ferry, and I came here. And to me, like, because I was born on an island, once they said Staten Island, I said, wow, an island? You mean I get a chance to start all over again, you know? And I also found out while I was at the rehab that I had AIDS, well, HIV to start with. You know, it developed to AIDS now. And then I started going to a support group for people with HIV at a place called Project Build. I started doing a lot of AIDS activist work with the city, you know.
Coming in with not just being an ex-offender, but having the virus just brings a whole host of other issues. And particularly that the staff would then know how to work with this person, what to deal with this person. So the support services would be counseling around, you have the virus, how do you deal with the virus? Would be referring people, making sure there's someone here to refer them to medical care, to have primary care, so that the first source is not using an emergency room, which so many of this population tend to do.
The biggest thing for me was disclosure about my status. I was always ashamed about being HIV positive. You know, it took like 10 years of me having this disease to actually be brave enough to tell my family about it, you know, let alone anybody else.
Where am I going to sleep? Where am I going to eat? How am I going to keep myself safe? Those are many of the things that are a whole lot more important than their HIV disease. And that's something that people who are working with this population really need to understand.
The biggest help and the biggest support that I got was our HIV support group that we used to have. I used to attend on Thursdays. And, you know, everybody was on the same page. You know, nobody was better than, you know, we all had that common bond, and it was just like, you know, what was going on with you, you know what I'm saying? It really was like concern.
Hi, this is Project Hospitality's Community Services Center, and it's home to our soup kitchen, which is open to the community, a supermarket-style nutrition mart or food pantry.
Well, I came into this work basically from a gospel perspective, from a religious perspective. For me, that was where God was, and I was really nourished and found meaning in working with people who were in serious need. They had so many gifts that were invisible to the human eye, and so I felt rewarded by that.
We embrace people with a spirit of hospitality, which really means reaching people where they're at and extending and welcoming them as though they were a guest in our own home. And we try to create a space called home in all of our centers. We provide for them, in addition to a place to lay their heads at night, different kinds of day programs that will meet some of the needs that they have coming from an institution like a prison. And those needs might be mental health needs, harm reduction, substance use treatment needs, HIV services, primary care, and an array of support services to help people learn to live with their disease at the highest quality of life.
I was scared to cross the street because of the cars, and there's a lot of fast-paced, you know, New York is fast-paced. So when I came home, it was like, I was so used to being, my environment was so structured And there's certain things, you know, I wake up, go to school, eat. Everything was, you know, on a schedule. But when I go to society, it was things that I needed as far as welfare, whatever. You know, yeah, I just go to the office with no ID and tell them I just came home and show them some paper. And I had to get some, you know, documents. So what the program helps me do is that instead of me getting in an argument over a seat on a bus or over, you know, on a train or getting frustrated because I go to welfare and, you know, the lady's not, you know, responding to me as I feel she should respond to me or, you know, whatever it may be. And instead of me lashing out, you know, the programs, you know, the counselors, you know, the staff member, they help me, you know, they talk to me and let me know that, you know, this is not the way you go about doing this. You don't go lashing out. You don't go cussing at people. You don't go if you need assistance. To make it out of it, you have to be part of the humane way. You have to do things the humane way. You can't, you know, if things don't go your way, you can't, you know, go off and punch somebody in the face or go off and stab somebody because everything has consequences. And a lot of things that, you know, a lot of situations can be resolved without violence.